vị và các bạn, Hội nghị truyền máu huyết học phía Nam lần thứ 4 đã được Bệnh viện Truyền máu và Huyết học thành phố Hồ Chí Minh tổ chức thành công tốt đẹp tại thành phố Đà Lạt, tỉnh Lâm Đồng. Đây là một hội nghị có tính chuyên môn cao với sự góp mặt của rất nhiều chuyên gia đầu ngành trong nước và thế giới về chuyên ngành huyết học. Chúng tôi đã có cuộc phỏng vấn nhanh với hai bác sĩ chuyên ngành huyết học hàng đầu tại Singapore, đó chính là bác sĩ Yvonne Loh và bác sĩ Mya Hae Tha. Các hai bác sĩ đều đang làm việc tại khoa ung thư máu và ghép tủy tại trung tâm ung thư Bệnh viện Raffles Singapore. Và sau đây là cuộc trao đổi với hai bác sĩ bên lề hội nghị này. We would like to introduce you, Dr. Mya, Raffles Hospital. Nice to meet you, Dr. Mya. As we have known, you are a hematologist with many years of treatment of hematological malignancies. So would you please share with us some information about your specialty and your specific interest at Raffles Hospital, Singapore?
I am a hematologist from Raffles Cancer Center. My specific interest in hematology is consultative hematology and the diagnosis of blood cancers like acute leukemias, lymphomas, multiple myelomas, and myeloid disorders, including myelodysplastic syndromes.
We have known that you are consulting for many patients of blood cancer in Singapore as well as in neighboring countries. According to your experience, what are the symptoms of hematological malignancy? And a patient who has a clinical hematological malignancy should be required to do some tests at Raffles Hospital, Singapore. So, could you please share with us what steps should patient with blood cancer should do at Raffles Hospital, Singapore, and how long do they have the results?
So patients with blood cancer usually present with weight loss, fever, excessive sweating at night, tiredness and bleeding. But sometimes they do not have any symptoms, and abnormalities are found on the blood test that is done for other purposes like health screening. Low blood cell level, which is anemia, and low platelet count are common abnormalities that are found on the blood count of these patients. And sometimes we do see abnormal blood cancer cells in the patient's blood if we examine it under a microscope. So it is important to pick up these abnormalities so that we can do further investigations to confirm the diagnosis. Further investigations include a series of blood tests and bone marrow investigations like bone marrow aspirate, that is examining the bone marrow under a microscope, flow cytometry, which is examining the proteins on the cells, cytogenetics and molecular assays, which is examining the abnormal genetic mutations associated with the blood cancers. Sometimes the patients also need to undergo imaging studies like PET scans, CT scans or MRI scans to know the staging of blood cancers. So in our center, there is a team of specialists who diagnose and treat these patients, and we have expertise and facilities to do all these investigations and interpret the results.
As per my understanding, patients should have the exact diagnosis to have the right treatment method. So, according to your experience, what are the important roles of the exact diagnostic test in treatment for hematological malignancies, and how to get the correct diagnosis, doctor?
So it is very important to get the correct diagnosis as early as possible so that appropriate treatment can be delivered to the patients without delay. Different types of blood cancers need different types of treatment and different intensities of treatment. So it is very important to get the correct diagnosis to the individual subtype of the disease. And patients with blood cancers, when they undergo treatment, they need chemotherapy or sometimes they even need blood stem cell transplant. And all these treatments have side effects. So it is very important to get accurate diagnosis so that we can minimize the side effects as much as possible. At the same time, we can give the patients the highest chance of cure.
Today, the flow cytometry is commonly used in hematological malignancy diagnosis. So, would you please give us know what is the flow cytometry? What are the role of flow cytometries in hematology as well as in the treatment of hematological malignancy?
Flow cytometry is an essential tool for the diagnosis of hematological malignancies. It is also called immunophenotyping. So basically our cells have proteins on the surface as well as inside of the cells, and different types of cells have different proteins. Including our blood cancer cells, they have unique abnormal proteins. So flow cytometry can identify these proteins and can tell us what type of cancerous cells that a patient is having. So it is a very rapid test which can be done in a matter of hours, and it can give us a very accurate answers very quickly. The World Health Organization has classified hematolymphoid malignancies into many different subtypes, and to be able to get the accurate diagnosis at the level of different subtypes, we need to apply various investigations, including flow cytometry, together with other laboratory investigations that I have mentioned before.
And now, what are the utilities of the cytometries in monitoring the minimal residual disease in treatment of hematological malignancy? And what are the new updates on the advances of diagnostic hematological malignancy by flow cytometry, doctors?
Flow cytometry is useful not only for the diagnosis of hematological malignancies, but also for the monitoring of the disease response to the treatment. So if a patient still has persistent disease at a very low level, even after treatment, it is called minimal residual disease. So to detect minimal residual disease which is present at a very low level, we need a test which has a very high sensitivity. So we need to study millions of cells at one time so that we can detect a very low level of minimal residual disease, and flow cytometry is one of the perfect tools for minimal residual disease assessment. As for the new updates, now we have a lot of advances in flow cytometry. Now we are using more colors in the antibody panels, which is like previously it was just 4 to 6 colors, and now it has become 8 to 10 colors, increasing the sensitivity of the test. And at the same time, there are internationally validated, standardized flow cytometry protocols which laboratories can adopt or adapt easily. So flow cytometry has really become easily applicable in most of the hematological laboratories.
Thank you so much for sharing with us the useful information about hematological malignancy, Dr. Mya.
Thank you very much for giving me this chance as well to share with you. Thank you.
Thank you. We would like to introduce you Dr. Yvonne Loh, Raffles Hospital, Singapore. So nice to meet you, Dr. Yvonne Loh. As we know, you are a famous hematologist in Singapore and in Asia too. So could you please share with us some information about your specialty and your specific interest at Raffles Hospital, Singapore?
Right, I'm a hematologist. I specialize in blood diseases, and my special interest is in treating acute leukemia and also in doing blood stem cell transplant.
Please share with us what are the common types of blood cancer which are being treated at Raffles Hospital Cancer Center, and what are the latest high-tech treatment for the blood cancer, doctor?
We treat almost all the types of blood cancers in Raffles Cancer Center. I specialize in treating acute leukemia and myelodysplastic syndrome, but I have a colleague, Dr. Darryl Tan, who also treats lymphoma and myeloma, which is his area of specialty. So together as a team, we treat all the various blood cancers, which include, apart from acute myeloid and acute lymphoblastic leukemia, we treat myelodysplastic syndrome and myeloproliferative neoplasms, along with the lymphomas and myeloma. And in terms of the new treatments that we have, apart from doing blood stem cell transplant, which is now a program about 3 years old, we also have newest agents and novel agents such as immunotherapy, targeted therapy, and new chemotherapy agents.
According to your experience, some common blood cancer we usually see is leukemia, myeloma, lymphoma, and Mya Loh dysplastic syndrome. And the best choice of treatment for the blood cancers is the blood stem cell transplant, isn't it?
Blood stem cell transplants are a very effective cure for many blood cancers, including acute myeloid leukemia and lymphoblastic leukemia, as well as for some lymphomas and myelomas. In the case of acute leukemias, we usually want to do a transplant from another donor, either a brother or a sister, or sometimes we also take from the unrelated donor registry or a haploidentical family donor. For multiple myeloma and lymphoma, most of the time when we do a transplant, it's from the patient's own blood stem cells. And they help to put the patient into remission and also to maintain the remission and even cure the patient.
So as we know, some blood cancer at Raffles Hospital will be treated with some novel drugs which may not be available on the market. So could you please list and share with us some information about these novel drugs and the effects they bring to the patients?
Well, in Raffles Hospital, we have access to some clinical trials, and this enables the patient to have access to some drugs which would not otherwise be available on the market. Also in Singapore, usually any new drug that has been approved by the FDA in America would usually be available within about 1 year in Singapore as well. This is often more quick than some of the surrounding countries in the region, and therefore patients who come to Singapore for treatment will have access to some of these newer agents, including immunotherapy drugs and small molecule targeted agents.
You have done the bone marrow transplant BMT for many Vietnamese patients as well as patients from neighboring countries. So could you please share with us what are the main types of BMT being applied at Raffles Hospital, Singapore, and what are the benefits the patient have when they choose to do the BMT at the Raffles Hospital, Singapore, and what will they should do to monitor the health after doing a BMT?
Yes, so I've done transplants in Raffles Hospital for the last 3 years, and prior to that in my prior place of work. So I have treated many patients from Vietnam as well as the surrounding areas who have gone through transplant, most commonly for acute myeloid leukemia, some for acute lymphoblastic leukemia as well. These patients usually come because they either have relapsed disease, and we've been able to cure a number of them. Some of them have been in remission for almost 10 years. Patients after transplant, however, have a very weak immune system. So often when transplant has been done, we advise them to stay in Singapore for about 3 or 6 months so that we can monitor them closely. The advantage of doing in Raffles is that we have a multidisciplinary team which comprises 3 hematologists along with specialists in infectious diseases and intensive care, and so we form one team to take care of the patients together with the nurses who have been trained to take care of transplant patients. Because we are a private hospital, the doctors also give very personal attention to the patients, and this way we can ensure a good outcome. We personally monitor their progress and we see them every day when they're in the hospital as well as when they come to the clinic.
Thank you so much, Dr. Yvonne Loh, for your useful information you shared with us. Thank you very much.
Thank you for having me on the show.
Thưa quý vị và các bạn, hy vọng rằng qua cuộc trao đổi vừa rồi với hai bác sĩ chuyên gia hàng đầu về chuyên ngành huyết học tại Singapore thì quý vị và các bạn cũng đã có những thông tin hữu ích về những kỹ thuật tiên tiến trong chẩn đoán và điều trị bệnh máu ác tính tại Bệnh viện Raffles Singapore. Vâng, cảm ơn quý vị và các bạn đã theo dõi chương trình của chúng tôi. Xin kính chúc quý vị và các bạn có thật nhiều sức khỏe. Xin chào tạm biệt.